ResearchConnect, a structured training and mentorship program to build research competency among undergraduate healthcare students in Bangladesh, a Public Health Foundation Bangladesh initiative. There are no conflicts of interest to declare. A great team of wonderful people made this project a success. Respected chair and co-chair of the session, my fellow colleagues, participants, renowned medical educationalists, and researchers from all over the world, good afternoon from Bangladesh. I am Dr. Shagufta Mohammed, and I would like to share our experience on this innovative teaching method. Developing research skills is crucial for evidence-based healthcare in Bangladesh. Undergraduate medical and dental students have limited research training opportunities. To bridge this gap, the Public Health Foundation of Bangladesh initiated ResearchConnect, a phased program designed to equip students with foundational research skills and guided mentorship over 6 months. A survey was conducted among undergraduate medical college students in Bangladesh in July 2020 to find out the attitude and perceived barriers toward scientific research among undergraduate medical students of Bangladesh. 1,279 students responded in that survey. More than half of the respondents expressed an interest in participating in research during undergrad curriculum. Majority of the respondents reported that inadequate time and priorities, insufficient guidance, inadequate familiarities with research methodology were the barriers towards research. So the objective of ResearchConnect was to equip students with foundational research skills and bridge the gap between theoretical knowledge and practical training. There were 2 phases in this innovative teaching method. The first phase was a 2-day immersive research methodology course with hands-on training. The course manual was developed by a group of public health professionals, statisticians, researchers, and academicians led by PHFBD. There were 30 participants and they were recruited by BMSS. At the end of the session, the participants were divided into 5 small groups. They had already selected their study topic and paired with specific mentors. At the second phase, it was a 6-month virtual mentorship program. Each team had structured virtual meetings. Lectures were conducted according to demand. Assignments were given. Feedback sessions were organized. A step-by-step research proposal were developed. Application for ethical clearance were submitted. Study findings were disseminated in conference. Manuscript was prepared for publication. Here are some demographic data of the participants. Among 30 participants, 67% were female. 93% of the participants were from MBBS background and 7% were dentistry students. 40% of the participants were 4th-year students and 37% were 3rd-year students. 73% of the participants were from Dhaka city and 27% were from outside of Dhaka city. It is an issue of cost. As you can see, when participants participate from outside Dhaka, they have to stay in Dhaka for 2 days. There is an issue of transport cost and also lodging. So it is totally depending on the funding. So as we didn't have a source of any fund, so we did not provide any support to the participants for this, and maybe that could be the underlying cause of less participants from outside Dhaka city. But in the next cohorts, we would like to have a balance between participants from Dhaka city and from outside of Dhaka and all over Bangladesh. These are some glimpses of the two-day research methodology training. As you can see, it was very interactive and the participants were awarded with the certificate at the end of the course. The two-day immersive research methodology course was evaluated using pre-test and post-test scores. With the coefficient of variation measuring score dispersion, the pre-test CV was 17% indicated variability in research knowledge, which decreased to 9% during post-training, demonstrating improved competency. After 6 months virtual small group mentorship, one team successfully presented their research at an international conference, highlighting the program's impact. Participants of the same team competed in a proposal writing competition and won the runners-up award. Here are some glimpses of 10th International Public Health Conference that was held in Bogura district in Bangladesh in December 6 and 7 in 2024. You can see the participants of Team 5 presenting their study findings. A facilitator-led feedback session emphasized the value of sustained mentorship in reinforcing learning and skill development, and recommended to extend the mentorship phase from 6 months to 1 year. Another recommendation was to include students from all healthcare discipline and social sciences to foster a comprehensive public health environment. A step-by-step research training approach is highly effective. A focused coursework combined with long-term mentorship, it enhances the research skill of the students, builds their confidence, and it enables creation of valuable academic work. It also strengthens the institutional capacity in public health research and multi-sectoral approach. In a country like Bangladesh and other resource-constrained countries, this approach really works well. These are the take-home message for this approach. We acknowledge all the support of our stakeholders. Thank you so much for your patience. For any queries or collaboration opportunities, you are always welcome. Please reach out to us.